So you may be wondering, what the heck is fatty liver disease? How did you get it? And what can you do about it? Well, in this video today, I will give you what exactly fatty liver disease is and what are some of the risk factors for fatty liver disease. If you wait till the very end of the video, I'll talk to you about why fatty liver disease is such an important topic today. Let's begin. So for those guys who are joining me today for the first time, my name is Dr. Samir Islam. Howdy you guys, from Texas, and my passion is to give you guys tips and tricks to help out with your gut health. If you're new to these video series, I would encourage you to subscribe, hit the like button. At any point in time in the video today, click on the show notes down below, which will give more information about the topic that I'm going to talk about today. But in today's video, you will learn two main things. Number one, what the heck is fatty liver disease? And also number two, what are the risk factors for fatty liver disease, or are you personally at risk for developing this problem, which is becoming more and more of an issue for a lot of our patients throughout the United States? So fatty liver disease, what is exactly fatty liver? This is actually the buildup of fat in the liver. So what happens whenever you have fat in the body from any number of different reasons, that fat can go anywhere in your heart, maybe in your belly, or in some places it can actually accumulate in the liver. The liver is a very common place where fat wants to go, and it can deposit in that area. Now, the most common cause for fat in the liver actually is due to a lot of the issues that lead to just fatness in general, or obesity, weight gain. So the more you gain weight in your abdomen and belly, the more of a chance you're going to have that fat actually go into the liver as well. Diet plays a significant role. The standard American diet, or the SAD diet, is a diet that is full of fats, processed foods, and just crappy foods. And those foods, that processed and bad foods, can accumulate a lot of problems in your body, and those problems can go into the liver as well. And that leads to obesity as well. And one of the risk factors for fatty liver disease is just being overweight because of the standard American diet, or the SAD diet. Now, here's the issue when it comes to fatty liver disease. Number one is that it is now the most common cause for liver cirrhosis or liver failure. And whenever your liver fails or doesn't work, this leads to the need to develop a liver transplant. A lot of people don't realize that. In the past, the most common cause of end-stage liver disease used to be either hepatitis or alcohol. But now there's this new wave coming up of fatty liver disease becoming the most predominant and the most common reason why your liver is not going to work or why it's going to fail. And the issue when it comes to fatty liver disease is that a lot of people don't realize that they actually have this problem. The second issue when it comes to fatty liver disease is that this is a rising cause for liver cancer. And so when you have cancer in the liver, this is a very serious condition to occur. And once again, the issue when it comes to fatty liver disease is that a lot of people don't realize that they are setting themselves up to develop cancer in the liver from the accumulation of fat. Now, why do people get fatty liver disease? The most common cause obviously is obesity. And the more fat that you have in your belly, especially around the central abdomen, the more likely that's going to go into your liver and cause problems. Diabetes. If you have a history of diabetes, or you are pre-diabetic, or you actually take medications for diabetes, there's a very good chance you have fatty liver disease on top of your diabetes. And that diabetes is most likely a contributing cause for why you can develop inflammation and issues in the liver. Having high cholesterols or having a problem with your lipids, if you take a medication like a statin, that most likely means that you're setting yourself up for having fatty liver disease. Or if you are on certain medications, this can also lead to fatty liver disease as well, including the medication like I mentioned before, a statin. If you don't exercise, if you're a couch potato, if you don't do any type of physical activity, you are setting yourself up as well to develop fatty liver disease. And lastly, alcohol. Alcohol causes a lot of different problems inside the whole GI tract. But one of the issues when it comes to alcohol is that alcohol can also lead to a buildup of fat in the liver, and that once again can cause problems including inflammation, liver cirrhosis, or end-stage liver disease. Now, like I mentioned before, once you have fatty liver disease, this increase of fat can accumulate in the liver, and that accumulation causes inflammation, scarring to occur in the liver, and what's called fibrosis. And it gets to a point in time when you have liver failure, or your liver actually doesn't work. And this can be a significant problem for a lot of our patients. It can lead to problems like ascites, or a buildup of fluid in your belly, vomiting blood, being confused. It's a whole mess of an issue. And when it comes to end-stage liver disease, the biggest risk factor currently is just the accumulation of fat. And the issue is that a lot of people, and this is the biggest thing I want you guys to come home with, is that a lot of people don't realize that they have this constant inflammation going on in the liver over years, over years, over years. And they don't feel bad. They feel fine. But that accumulation over the course of time will lead to end-stage liver disease. The second complication that can occur is cancer in the liver as well. That constant inflammation, the constant ability of the toxins in your body because of the fat to cause a lot of inflammation and fibrosis to occur will lead to liver cancer. It is such a sad story. When I have a patient come to see me with a new onset liver cancer, I realize the most common reason why they had it is because they weren't taking care of themselves. They were eating a lot of fat, they had diabetes, they had obesity, and these are all very preventative causes from causing liver cancer in the body. And so, end-stage liver disease from fatty liver disease is a current problem right now. It is probably the most common liver disease that we have currently in the United States. But there are solutions and options that we can talk about. In the next couple of videos, I will talk to you about what some of the options are, what some of the symptoms are, and what you can do to make sure you don't develop this particular problem. Well, thank you. So my question for you guys is, what questions do you guys have about fatty liver disease? What can I help answer for you about the issue of your liver, the issue of your fat, and what we can do to hopefully prevent this from causing problems for you? Comment down below. I would love to hear what you guys have to say about this. Or if you don't want to comment down below, feel free to send me an email as well. I want to thank you guys for watching this video. Every Tuesday around this time, I do my Facebook Live, and every Thursday, I do a Poop Tip Thursday, where I try to drop one poop bomb for the week. Don't forget to hit the like button to get more videos, so you can get that bell rung as well. I'd encourage you to follow me on social media. Well, thank you guys for watching. I look forward to seeing you guys in more videos. Thanks and take care. I want to thank you guys for watching this video. Don't forget to click here to subscribe and click here to hear more information about what you can do about fatty liver disease. Fatty liver disease. Fat accumulates in the liver, big belly, big fat.